COVID-19 has, been unprecedented in so many ways. One of which is the degree that doctors and public health practitioners, scientists, even politicians have become almost lay journalists. And this panel discussion will delve into whether these interjections have been a help or hindrance, both to the public and to health journalism as a whole. In the invitation that was sent out, the short bios have been given, but it's a really tremendous pleasure and an honor to welcome our three panelists, extremely distinguished panelists, and just in short, first to welcome Tamar Kahn. And these panelists will be known well to you all, but Tamar is an award-winning journalist. At Business Day, she's had 20 years of experience in health and science journalism and a really diverse background with a BSc in physics and education, an MSc in science communication, and an MBA from UCT. And she really is, one of South Africa's foremost health journalists, and it's a real pleasure to have her with us. Mark Heywood, again, very well known to everybody, I think, but a social activist and a co-founder of two real powerhouses of social justice, the Treatment Action Campaign and Section 27. He's currently the editor of the Maverick Citizen, which focuses on his core interests of activism, human rights, and social justice. And he has multiple university affiliates, including UCT, Georgetown, and Oxford University. And then Francois Venter, again, well known to everybody, head of Zincha at Wits University, probably best known for his clinical research and activism role in relation to HIV and his very active interest in medical ethics and raising cats. So all of these panelists, three panelists have played leading roles in health journalism during COVID in different ways. Both each, hardcore traditional ways, maverick ways, and as educationalists and challengers to government in some respects. So what's going to happen is I'm going to put a series of questions to our panelists and really to start the discussion. Sort of as way of introduction, Tamar and Mark, and Tamar, perhaps we could kick off with you. I mean, it would perhaps be self-evident, but I'm interested, if we're going to talk about health journalism, to really understand a little bit about what skills health journalists have that clinicians and scientists may lack. And it'd be great to get a perspective of your journey, and then perhaps Mark to ask you that in brief. Thanks. Over to you, Tamar. Okay. Yeah, we're just going to ask you to unmute.
Okay.
Great.
So I think I would actually just pick up on something you said right at the beginning when you talked about clinicians as journalists. I don't think they are. I think clinicians during the COVID crisis have become much more public and prolific communicators, but they haven't become journalists, because at the end of the day, they're not answerable to the same regulatory bodies or the same bosses. They're answerable to the institutions that employ them, and in some cases to the professional councils that govern them. They're not answerable, for example, to the press code. I think that said, there are many, in many respects, clinicians, scientists, and journalists have a lot in common. I would say both curiosity-driven, interested in knowledge generation. But I think the way we go about things is often very different. I get the sense that clinicians and scientists in this area will often communicate when they're driven to try and get a message across. And whereas a journalist is more often driven by a need to understand, to communicate, and to hold those in power to account. Now, clinicians and scientists may be doing that too, but I think the way we go about it is often very different.
But do you not think that, I mean, there's a lot have been written by scientists and clinicians. And so do you not think they have become health journalists in some way? Are they usurping your role at all?
No, I don't think so. I mean, the reality is that when I first became a journalist more than 20 years ago and started out at the BBC, It was, you know, a journalist would invite a clinician onto the air for a discussion or perhaps interview somebody. But, you know, 20, 25 years later, there's social media, and anybody with the energy and desire basically gets a megaphone. So there are many more platforms and many more spaces and many more voices. And I think it's really important that there are clinicians and scientists who will take on people with often off-beam messages or agendas, because that space is so wide open, and journalists can't do that, right? We kind of have I would say we have a different drive, and there are overlaps, but it's not the same thing.
Okay, so Mark, your thoughts? I mean, what are your thoughts on this?
Yeah, look, you know, obviously I come from a very different background to Tamar. I've been an activist, as you mentioned, for 30-something years, and in the last 2 years have begun to work within journalism with a particular focus on social justice, health, and human rights. And the first thing that I would say, Mark, is that I think it's interesting to compare how we've written and reported on COVID-19 with how we wrote and reported on HIV. And it's very interesting that I think we have benefited as journalists, but also as scientists, from relationships and lessons that were established through HIV in many respects, and in particular through the networks that were built up on trying to communicate and trying to report around the HIV epidemic. So I think that is something that needs interrogation. I think that the quality of journalism in relation to COVID-19 has been so much greater, so much better. That's not that it's faultless, and perhaps we'll come later to what's been problematic about journalism. But if you look at the quantity and the quality and the variety of journalistic sources writing around COVID-19, and I think journalism has understood one of the critical skills has to be to understand the science that you are reporting on. That's what we learned as activists in relation to HIV, and that's what we tried to teach to journalists in the early 2000s. Understand science, be HIV literate, be COVID-19 literate. So there's been a lot of improvements, but the other things that I think are critical, and you can see it again here with the people you've got on the panel, have been the networks and how those networks act to convey information. You know, it would be very interesting to make a study of how information gets fed into the media space and by who when it comes to COVID-19. We would learn a lot from that. And the last thing that I would say is that I agree with Tamar. You know, I don't think scientists have become journalists by any stretch of the imagination. The problem is that scientists and clinicians are actually not very good writers for the most part. But I do think that clinicians have understood the importance of communication and have become much better communicators and have used forums that have been created by journalists to communicate science. Now, again, I feel like that's a double-edged sword. Have we done it well? Well, we've done it well. We've reached a certain sector of the population, a sliver of the population, but I believe we've left a lot of people out at the same time. You know, we've worked to counter misinformation, and I think just looking at the people who are on this webinar, you know, we've been very effective at countering fake news, but there's a flip side to that. How effective have we been at ensuring that journalism entrenches the science, the understanding, the power that people need to navigate the COVID-19 pandemic in healthcare settings, in communities, et cetera, et cetera. So I think there's very many dimensions to this discussion. I'll pause there.
Thanks, Mark. So Francois, I mean, having been also, you know, as introduced, extremely active in HIV and active in those early days, versus your activity in COVID. Do you see the comparison? Do you think there are differences in what's played out in COVID this time?
Yes.
In reporting?
Yeah, I think it's interesting. I think a lot of COVID has been sort of fast forward on speed of the kind of HIV response. I think what you saw with HIV was a very coherent civil society supported by some key journalists who actually really clued up in what they were doing, with a few hang-on journalists who were trying to just tread water around the science, with a few sporadic healthcare workers contributing in all of that. That was a very powerful movement. I think COVID, though, has supersized that astronomically, and there's been a good side to it and a bad side to it. I mean, you've seen journalists having to become health literate in no time at all. And I think you've also seen clinicians and public health people starting to appreciate the role of the media in terms of broadcasting, particularly as government's communication strategies around COVID, I think, have been woeful. But there's also been a dark side to this. And I think the one is that there's been, firstly, I think clinicians have conflated themselves as scientists. And I think journalists often think that as well. And we've seen a large number of clinicians in particular playing into, firstly, demonstrating a real level of scientific illiteracy, but also playing into really reckless behavior around, propagating conspiracy theories, crackpot theories, not seeing their role in terms of this. And I think I've been quite shocked at our community at how little responsibility they've actually taken for making sure they don't throw these hand grenades into the media. And I think the ivermectin debate is a very good one, actually, and probably is one many people on the call have had to deal with. But we're seeing senior clinicians and people in academia, promoting vaccine hesitancy, and as I said, all sorts of and form of conspiracy theories. So while I think this has been a real learning side for us, and as Mark points out, many of the scientists have had to learn how to write so that people can actually understand them. At the same time, I think the lessons here for how do you communicate and how do you have a responsible conduit of information.
So COVID is HIV on steroids, and yeah, so it's been even faster, as you say, in terms of having to keep up. So one of the issues has been the rise in scientific information coming in preprint forms and being communicated in press conferences before the paper has even got into preprint in some ways. Tamar, how has this been a challenge to you in how you report?
I would say, first of all, it's only a part of what I do. I mean, I don't only report on science and emerging science. I think one of the really challenging things for all science and health reporters in this time is to try and find a way to convey the uncertainty that goes with those kinds of publications and releases. And that's where journalists who had to parachute into becoming reporters on COVID face a particular challenge. But I also think scientists themselves aren't always very good at conveying the uncertainty around the work that they're doing, that they're publishing, and they're communicating. And before we came on this call, I was looking through some press releases that have come through around vaccines, thinking you can really see how those often the press releases are put out by a company that's listed on the NASDAQ or on a European stock exchange. And it's framed in a very particular way. And it's not necessarily providing a journalist here in South Africa with the information they need to provide to their audience and give a sense of what this means for South Africa. And that's where the way these things get put out is particularly challenging. It's not a press conference. You're not in an environment where you can talk directly to the scientists involved. And the scientists involved are to some extent beholden to the people who are running that trial. Right. So there's a message that's put out, for example, let's just take Novavax. That their press release that goes out to journalists lands at the end of the day, at the end of the news cycle for many of us. And it's put out in a format that conveys key information to shareholders because it went out on the NASDAQ. It doesn't necessarily contain the key information we need to report accurately on it. And I'm going to come back to my original point, it never conveys the uncertainty that comes with it. So the first statement that went out about the Novavax trial, which was based on a preprint, ended up having slightly different numbers about the efficacy of the vaccine to a follow-up press release when the research got published, I think in the New England Journal of Medicine. And I think as journalists, we are often absolutely terrible at following those kinds of nuances and capturing that even at the point when that particular vaccine trial ended up in the New England Journal of Medicine, there's still a big question about that particular vaccine's efficacy in people who have HIV, which is hugely important for South Africa. And the reason being that that study wasn't designed to answer those questions, and the numbers of people who had HIV in the study were very, very small. And I think for me that encapsulates just some of the challenges we face in trying to report on the nature of what we're confronting right now.
So I know from experience that you're very meticulous about gathering your information, and you'll talk to the right people. One of the issues has been that I think a lot of, a question I have for you is that a lot of health reporting in South Africa has gone to people who may not be really specialists in the particular subjects that they're being asked for. Because they're a name, they are asked various questions about issues that perhaps they don't fully know. Has that impacted on how you're communicating and what the public is hearing? Do you feel that? Do you see that?
Are you asking whether journalists are going to the wrong people, or are you asking whether the wrong journalists on the subject?
No, I'm asking if the journalists are going to the wrong people, and if so, how's that impacting?
So I think that's often the case, COVID or not, because a lot of the time the people we speak to are a function of who's available at short notice, who is articulate and media friendly. Often I'm asked whether I make a particular effort to look for women, for example, in stories. And my answer to them is yes and no. There are times when I need the person at the helm, and the gender split we see as a function of society. So quite often people will go to the person at the top. If you go, for example, to a cabinet minister who is the appropriate person to respond, but that person tells you something that is patently nonsense, if you don't have a basic level of knowledge about the subject you're interrogating, you're going to report it word for word without that context. And I think that's one of the big dangers of going to the wrong people, in inverted commas, who in some ways are the right people, but in other ways are the wrong. And I'm thinking today of a press conference that was held by the acting health minister, which I didn't cover, but I'm seeing the way it's being reported. And she's quoted as saying that more intervention is required in Gauteng because, quote, people are protesting running without masks. And yet the science, I think, has moved on to the point, and the regulations have moved on to the point where nobody is legally required to run with a mask in South Africa. And yet it's being reported verbatim without the context of, but hold on. So yes, journalists do sometimes go to the wrong people, and sometimes the supposedly right people don't always say quite the right thing. So
taking that forward, Mark, a number of people have come to you to write and to publish in Maverick. How do you balance what you allow in and what is generated from your own sources?
That's a very good question. Look, we have tried to give a platform to science and the scientific community around COVID-19 with a view to informing public understanding and public opinion. I think of the very nuances that Tamar was talking about just now. Whether that's succeeded or not is another question. So if you take, for example, the innovation around the Daily Maverick webinar series, where sometimes we've had up to 2,000 people on a webinar. You have tried to draw the leading voices, the leading scientists, the leading clinicians to be on those webinars to talk to and to clarify certain key issues. And I think that has been a service. I think that innovation has been important. It's more, though, than I think what you also have to recognize, though, is that it becomes more than just about the science. it becomes about the politics very frequently as well. And these interventions often become political interventions that shift or shape the debate that is taking place within society and with the government and with the MAC, with the Ministerial Advisory Council, about what is the best way to respond at a particular point in the epidemic to a particular challenge. And I think you need to think very carefully about how do you mediate those, because there can be unintended consequences, particularly because, as Francois said, this thing has been a pressure cooker from the very, very beginning. And you want to be able to give certainty where still it's largely the environment is characterized by uncertainty. So that's one aspect. But the second aspect, I think, it is the challenge. Okay, so you can create a platform for the scientist collectives. And, you know, we at one point published this series of advisories by leading scientists, cross-disciplinary scientists. And I think they were very, very helpful at a particular, I mean, some of them got, you know, 300,000-400,000 readers, particularly the early one. Francois was involved in dose dispersal. Francois, you can remember it, but I think that's playing a public interest role. But I think, you know, I want to go to where Tamar was a second ago. I think a challenge for journalists is that even where you are dealing with scientists of repute, with all the right bona fides, how do you filter what you are receiving? How do you check what you are receiving? Just because it's Francois Venter doesn't mean it's right. Doesn't mean that your job is just to regurgitate. There has to be some filter, which again, I think raises questions about, well, what filters do journalists have? To, you know, what training do you have to distinguish between a preprint and something that has gone through peer review and it is published? You know, I don't think there's enough discussion going on about that. It's interesting that we're raising it here and that we're raising it now, because it is a new set of challenges, and it wasn't a set of challenges very much in the days when we were dealing with HIV or before COVID-19 came along. So I think that there are bigger pitfalls for us than we acknowledge. I sometimes, you know, look back on some of the things that we did, that I wrote, and I wonder, was that helpful ultimately? Did we play a role in polarizing something when actually it would have been better to keep the balls in the air? Yeah, perhaps we can come to concrete examples later, but I hope that part the answer. I don't have a cut and dry answer to your question, Mark. Answer questions with questions, but perhaps there's value in that.
No, I think there's great value in that, and it's interesting. And I want to come on now to Francois, because, you know, one of the leaders of the scientists collective, who, you know, came to the Daily Maverick largely. I mean, there was a balance between publication in Daily Maverick but also, you know, in the SAMJ and other bodies. But what did the scientists collective bring to the health? Okay, if we're not calling it health journalism, perhaps, however we want to frame it. I mean, what do you think the role there was, and what was missing that required the scientists collective?
So it was an interesting experiment, and I think for the time it ran, it was a fairly successful one. I think there were two aspects to it. The first was the frustration with government's lack of communication. You know, there were key messages that just weren't getting out there. I think the second attached to that was those of us involved at the Ministerial Advisory Committee, where a lot of good discussion was had, and really, you know, quite groundbreaking stuff, especially around masks and some of the stuff. We were ahead of the curve internationally. And in fact, some of those scientific collective things were republished in Turkey, in Greece, and South America, because the whole world was grappling with this lack. It wasn't just our government, it was governments across the world. So I think that there was a sense of, you know, generating information, and then for political reasons, the Ministerial Advisory Committee was not releasing that information, still hasn't. Coupled with that was our own experience within the HIV community, which is when you have a whole of fractious clinicians and scientists, the best place to actually get consensus is to put them down in a room together and let them have the fight behind closed doors until they can come up with some sort of cohesive way forward. And we found that was actually really useful. And obviously it was all by email. But what we would do is put forward a statement that people could disagree, agree with, and we'd compromise around, and then we'd be able to wordsmith it to such a degree that actually we would be able to submit something that was, one, really importantly, consensus building amongst those scientists. So there was this is what we did with HIV. Everyone would have an opinion on X, and somebody would come forward and say, this is the evidence, and somebody else would say, that's the evidence. Everyone would have their fight behind closed doors, and then there would be a consensus statement that came out of it. So to my mind, that was actually very useful because there was a clear message to the public repeatedly that came through the Daily Maverick articles. So I think it was a lesson for all of us in terms of health communication.
So just to pick you up on one of the things you said, I mean, yes, it was done behind closed doors, but there were a number of issues during the last 16 months that have been, very controversial and played out very much on the public sphere. And some of the writings and have been involved in those, including in the SMJ and in the Maverick. Is there a role for public spats? Do they forward in terms of in the media and clinicians and scientists being involved in those openly? Or do you think they're a help or a hindrance? And I'll come on to Mark and Tamar to ask the same thing.
So I do a lot of internal reflection on this and my own role in that. And they have been, as you mentioned, those spats. I think the most prominent one has been around sending the vaccines off to the rest of Africa, and with the head of the Vaccine Advisory Committee, and as well as others. I think that we've played a role in asking the very harsh questions: where are the vaccines? Where are they? And I think that there's certainly been a lot of anguish from my friends, from my family, from journalists, from the general public about how can you people be leading us on the one hand and confusing us on the other. And I think that that's been really difficult to deal with. And I don't have an easy answer for that. I do think that journalists need to appreciate that, as Mark said, sometimes people with really good credentials can be hopelessly overconfident in what they are pronouncing. And I've seen very senior scientists in this country talk very confidently about herd immunity when they patently don't understand what that means. And the problem with that is that they have the credentials, and every journalist would be silly not to take them at their word. So it's a hard one, Mark. And I think that for many of us in the scientific community, holding our own more accountable for making outrageous statements or for getting it wrong, and also for being able to also say when we were wrong and any of this, I think is important. I don't have an easy answer for it. I think that you've seen the cult of personality among scientists step up in the world across the globe, of some people like Fauci standing up and showing, to my mind, admirable leadership. But in other countries, there have been a series of crackpots as well, sometimes with really good credentials, who've been able to stand up and talk the most, really put out really dangerous stuff, to my mind.
So Mark, the open sort of not warfare, but the spats that occurred. I mean, the night of the long knives when the Mac was slashed, and a number of the South Africa's most leading clinicians and scientists were suddenly found themselves no longer there, was quite public. Did that help or hinder the South Africa's COVID mission?
I think it helps and hinders. I think it more helps than hinders, because I don't think it's up to us as writers, as journalists, to think that we have to protect the public, that we have some role protecting the public from disputes that may be taking place within the scientific community, particularly when it's something as new as COVID, and disputes are central to advancing understanding, the resolution of disputes, and sometimes allowing media to be the forum where these disputes play out moves the needle forward. At the beginning of this year, over the vaccines question when we carried the letter from, I think, Glenda, from Shabir and other people in which was written in very strident terms about the impasse, the problems with the Ministerial Advisory Committee, the slowness on vaccines. That I think was a political intervention that was underpinned by science and medicine, and that it had a beneficial impact. I think there's a linked question, Mark, though, which has again become much more evident in the era of COVID, which is, health used to be very marginal to reporting, to life generally, whereas COVID has made it very clear how central health and disease is to well-being and is to politics and is to economy, etc., etc. So I think journalism has a role in raising public understanding of issues to do with health and to do with disease, etc. And if you're not raising public understanding, then it's more difficult to engage with these spats, to engage with these disputes, to work out where is right or where is wrong, or to make your own mind up about it. So I think that's an important aspect of this discussion as well. And how do we do that? So yeah, generally I would say help, but again, the framing is important. I think to allow disputes, but not trying to inflame. So if it's at all possible to allow the discussion, but to take some of the heat out of it, at the same time, to not allow polarization to develop is very important. The last thing that I would say, where I think there's been a mission on this side, is that we have so elevated medical science, and I think this is a problem with the response as a whole, that we have obscured social science. And we should have given much more air and attention to the balance between social science and clinical science and medical science, because I think they are critical to each other when it is a matter of turning them into practical interventions and policy aimed at disease prevention and care.
Thank you. I mean, I definitely agree. I think it has been a missing link. Tamar, I want to just push you on one of the particular aspects, because scientists, clinicians, and others have often been very critical of health journalism. And, one of the issues that's come up, which has really taken center stage, and perhaps one of the most polarizing issues apart from vaccine, is the ivermectin issue. So, there's been a lot of people making comments in the media, doing radio and television interviews and writing. How do you counteract that? And does it have a place? I mean, what are your thoughts?
So, I mean, I think what you're touching on is an issue which is emotive, has people with very strong opinions on the pro-ivermectin side. And reporting on it for journalists who don't have a grasp of the regulatory environment for medicines makes it incredibly difficult. So if journalists have had a bit of training or had some experience in reporting on it, I think in some ways the ivermectin, the regulators' initial response to it makes much more sense. But if you're coming in cold and you haven't got a grasp of that regulatory environment, and the importance of evidence-based medicine and the dangers of using untested medicines in the hope, even if the intentions are good, makes it really difficult, and there's huge capacity to do harm. And the answer to solving that problem, unfortunately, is something that we really battle with in South Africa, which is the lack of resources in our newsrooms. So when I was reporting on the AIDS pandemic in the early 2000s, I think every major newspaper in South Africa had a dedicated health reporter, and some had more than one. I mean, the Independent Group had regional newspapers, each with their own health reporters. Mark said just now that, COVID has elevated health in a very particular way. I think AIDS did too, because it was so fiercely politicized and politically contested. It was an era where the health reporting was really prominent. The big difference then for health reporters was there was a lot of money around for health journalists to exist, and also for training health journalists. So, I was given opportunities to go to conferences, to get some training on how to think about AIDS reporting, what kind of language to use, what kind of issues to be wary of, what is the process by which new treatments, vaccines, diagnostics were being researched. That's missing in the era of COVID, partly because of resources and partly also because of the speed with which everything is coming at us. So I think it's quite a long way of saying I think it's incredibly difficult for many reporters to report accurately on the issues around ivermectin and to try and capture some of the uncertainty. And there's also been a huge gap in communication from the powers that be. And into that gap will step anybody on social media who's got the time and energy to start campaigning.
Mm.
So just to pick you up on that, because one of the gaps that was attempted by government to be filled was public engagement on television and radio with large-scale presentations, quite detailed presentations that the health minister chaired, and was given PowerPoint presentations by the chair of the Ministerial Advisory Committee, etc. How important and how well did that do in actually communicating the health of COVID in the media, on a scale for media, for the public? Was it successful? What would you do differently if you had been in charge?
Oh, that's a loaded question. So I think, first of all, I can't really give you an informed response as to how effective it was. For that, you'd actually need some solid research. I don't know. I mean, I can tell you that as a journalist, those evening presentations were absolutely incredibly difficult, because I work for a newspaper which has a print deadline at 9 o'clock. So trying to do that kind of reporting at speed is very stressful. There's a huge risk that we get the tail of the dog, that we get it wrong. It doesn't allow for more measured, thoughtful, reflective journalism. It doesn't allow for the time to seek alternate views, to say, does this make sense? So it puts a lot of pressure on the journalists reporting at the time. And I would say also for people reporting for the web, who need to get a story out immediately in the way the wire reporters do. There's huge pressure on that individual to kind of digest, assimilate, and put it across. I think so in some ways they were good. They had those briefings to the public, certainly provided some information, but I think one of the big downsides for me as a journalist is they create the illusion of availability, but in actual fact they were more like a broadcast. So those presentations were not followed by the usual give and take between people trying to put across a message to reporters and the reporters themselves. So pre-COVID, we would go to a press conference. You would be in a room with the people who are putting the information across. You'd stick up your hand. You'd ask your killer question. It wasn't answered. The person would try and duck. You'd interrogate it. You could publicly try and embarrass them if they weren't answering your question. And if they really didn't answer your question, or you didn't want to give away your killer question, well, you'd have a word with them afterwards in the corridor. There was a lot more opportunity for real engagement. That's all gone in the era of the virtual press conference. Questions go through gatekeepers who vary in the extent to which they are able or willing to pass those questions on to the person in charge, and there is no follow-up. So for me, they are quite frustrating and often very superficial way of conveying the information. And if you think back to the early days of the epidemic in South Africa, when there was a lot of focus on what the modeling predictions were, too many of those events failed for me to capture for the general public the immense uncertainty around those kinds of modeling projections, and that a model hinges to a large extent on the inputs. And in the beginning, they were very simple. There was only so much they could model. And that great uncertainty wasn't adequately captured. And so then we saw this huge debate about, are they right or are they wrong? And yet there's an inherent characteristic to that kind of work, which it's a projection. It's kind of an educated guess about where we're going based on the limited amount of knowledge at hand at the time. It is not a hard and fast foretelling of the future.
Yeah. So, I mean, there's two aspects, I guess, from what I'm hearing. You know, you saying that there's no longer that ability to question and to have dialogue between. It's being presented with large amounts of information which perhaps are not being communicated well enough, and you're not able to actually go back. So Mark, I mean, for you, did we get it right? Were the wrong people communicating? Was it just that the people were bad communicators? Did it have a role? This is a role of clinical, I mean, one can debate what one calls health journalism, but it was a way of clinicians and scientists trying to communicate information to the public. A help or a hindrance?
No, overall a help. But Mark, as we all know, you know, it's not that we're looking back on something that's over. We've got a long way still to go with this. And so this type of discussion is very helpful to process, kind of midstream, as it were, what's been done right and what has been done wrong. I think that there's been bona fide, you know, everybody, I think the scientific, the clinical community has tried very, very hard to make itself accessible, available, to explain these issues, but it's done so in an environment that is very fragmented and very, very difficult. And, you know, as Tamar has just said, on the journalist side of the equation, you are being pulled in many directions at the same time. And so often it's not possible to give an issue the kind of sustained attention, a complex issue that it requires to properly unfold that issue before a viewership or before a readership. But, you know, at this stage, I would say much more a help than a hindrance, but with all of my caveats. You know, I think, again, the big factor has been this gap where there should have been very slick, efficient, thought out, proper theory-based communication coming from government. There's been nothing there, really. You know, Slim Abdul Karim's presentations were very slick in the early days of the pandemic, but you know, when it wasn't Slim and it was somebody from the minister himself or somebody from the department, there was an incredible variability. Again, has been said, there's been the impression of communication, but not the substance of communication. You know, we've been drip fed certain bits of information, but not other parts of information that people need to properly internalize and make sense of the stuff, the figures that are being continually drip fed. And the figures that are being continually drip fed are so selective. There's so much more that you need to know. But then occasionally there's been damage. I mean, you know, we haven't interacted with the people who are watching with us today, but I would say, for example, the way in which the decision to pause the J&J Sisonke trial was communicated by the minister, Zweli Mkhize at the time, was appalling with that press conference that evening, and then feeds the people who, remember, you know, a flip side to what we're talking about is that there are some people out there who are wanting to misinform, who are wanting to stimulate fear and misunderstanding and further breed the uncertainty. So you've got to, as you communicate and write about these things, consider all of these dimensions at the same time. Yeah.
Okay, so that's interesting. So in the last 10 minutes, I want to just get thoughts from each of you. About if there's a specific pressing issue that we haven't discussed, but as you said, Mark, this is an ongoing issue. We're now in our third wave, and it's important that we do look critically back at every aspect of the response to COVID. And one of those, as we're discussing today, is around how it's reported and who does the reporting. So I'd like to ask each of you, what would you do differently now going forward? What do you think the needs are for communication, both from clinician scientists, public health experts, and also and the journalists? What should we be doing? Is it the same, or is there something new, and should we be finding different ways? So I'm going to ask Francois first.
Look, I think there's still the kind of scientific collective thing we were doing. I think it was so much work in the situation where we were all under cudgels, and we're not natural writers. So, to get 30 people to agree on an article was a labor of love. But I think that's needed. And I think that trying to get that consensus was very, very useful. It would have been really useful, for instance, because I'm seeing very different messages from individuals in the scientific community in terms of what government should be doing now in relation to the third wave and what aspects of lockdown. It would have been nice to have that discussion. When I say behind closed doors, I just mean as in just have a robust debate and tease out.
Francois, I think you've frozen. Can anyone else?
So that we are more on message. Am I back?
You're back.
So
yeah.
I think in short, the scientific collective, the just the kind of consensus building thing, so that there's a trusted element that's across institutions, that's polydisciplinary, that people can trust, that you can send out, that's being curated quite carefully by people like Mark who can look at the English and make sure it's all understandable.
Mark, what are your thoughts?
Yeah, it's not an easy question, Mark. There's quite a few things I'd say. I just noticed a comment by Wendy Stevens in the chat talking about recrimination following communication not infrequent in many health environments. And we haven't talked about the impediments to effective communication by journalists. And I'm certainly picking up at the moment, more people fearful to say, I will attach my name to, you can quote me on this. I was writing something this afternoon, in fact, about this horrible surge that's going on in Gauteng at the moment, and talking to people at Chris Hani Baragwanath Hospital who don't want to be named. Why would somebody be afraid of telling the truth about the crisis at Chris Hani Baragwanath Hospital of the third wave of COVID-19? So there are factors like that. But I think, it's a continual learning process. That sounds like a soft and easy thing to say. But what different? I would want to pay more sustained attention to some of the issues that have cropped up, so that knowledge and understanding accumulates rather than is once off. As a few people have said here, I would want to get more nuanced and better at conveying the uncertainties, not as a source of weakness or journalistic lack of ability to tell a story, but that is part of the story. And then I think for me, a big issue that journalists should be asking themselves, and scientists, by the way, is what is our reach? I think we're having discussions in a small sliver, relatively small sliver of society, and that should worry us. We're talking to people who have access to digital stuff so that they can sit watching a webinar on a Sunday evening, they have the data, etc. We're writing for newspapers that cost $25 a shot, and or in things like the Daily Maverick, which have a reach, but a limited reach to a particular demographic of society. It worries me that so many people are being left out of the news, as it were, around COVID. And that doesn't help nation building. It doesn't help pandemic responses. It doesn't help prevention or understanding on issues like vaccines and care et cetera, et cetera. So I do think, as you've done this afternoon, that there's a need for quite deep introspection to recognize, oh, sorry, I'm saying too much, but
no.
It's been very positive in many respects. The people who are on this call who've contributed have played an enormously positive role in making themselves and their science available, but we have to recognize at the same time the limitations that we face.
So I'm going to come to Tamar, but maybe if we have time, I'll just come back to you. Maybe you can think about how you would increase the reach. But maybe, Tamar, I can ask you that. I mean, firstly, for your thoughts on this issue, but also the question of reach and how we get to those people who we're not reaching at the moment.
I can't answer that question. That's asking me
Okay.
to go way out of my lane. I'm afraid that's not my area of expertise. But I would actually like to just hop back to a question you asked me earlier about what health journalism, how should health journalists approach reporting on COVID and the people we interview. I mean, a long time ago, I had a kind of rubric that I used which was taught to me at some point, which is to think about and ask the question, who is the messenger? Who is this person putting out an opinion or a piece of research? If it's research, who funded it? Is this a pharmaceutical company? Is it a think tank? Is it a think tank dressed up as independent that's actually funded by industry? Has this research been peer reviewed? And 20 years ago, I would get peer reviewed embargoed press releases for research that was coming up days ahead. That's no longer the case, as you said. Things get published on preprint servers. The one thing I have seen there is that really bad, controversial, bad science gets decimated on Twitter quite often. I had a fascinating conversation with Tulio d'Oliveira about the value of Twitter, and he was like, well, this is where we put our stuff out and it's where we challenge one another, and it can happen very fast. The paper can get retracted within 48 hours. I don't think journalists are always aware of that and how much debate happens around these preprints. Certainly, I'm speaking for journalists here in South Africa, and I think it's important to kind of think a bit about that. And if it's not even being printed, if it's not being published, then why? I mean, perhaps it's something that's being presented at a conference. It still has its place, and then that needs to be captured and reflected. I think your question about what to do differently, I mean, the big luxury for us at the moment, I think, is time. So to be able to do things a little slower, to have a little bit more time to reflect and to kind of digest what we're looking at before we report it would be hugely valuable. So if there's anyone from government on this call, my plea would be to do more morning briefings, please, rather than 8 o'clock at night ones. I know prime time television is important, but it's actually really got hard to do good, accurate reporting at lightning speed.
Do you think, though, that perhaps there's too much? I mean, from a point of view, from many of our points of view, we're being asked the same question, basic questions, for which the information is already out there. What in terms of the new waves? Should you be wearing a mask? Should you social distance? There's a lot of still being written about this, which shouldn't really be the focus anymore. I mean, it should just be referred to, government guideline or whatever, because that information's there. Are we moving enough towards the newer issues around COVID and reporting those?
I don't know. I mean, I think there is still a gap in communication coming from government, and that puts a lot more pressure perhaps on readily available scientists to do it. The other thing is that I always think journalists consume media in a very different way to the general public. We often think, well, we've written it once, why write it again? But not everybody reads everything we write. And I think the same is probably true for scientists and clinicians being interviewed or trying to get a message across. 6 weeks later, there will still be people who will find what you have to say is interesting and relevant, even if you have said it before, either because they've forgotten or because they just didn't read it the first time around. So I think there is a lot of value to continuing to put across a message that maybe old hat to you, but it actually isn't to a lot of people.
Okay. Very briefly, Mark, I'm going to come to Marc and Francois. So Mark, 1 minute on how do you increase your reach? How's Daily Maverick going to actually work to increase the reach to those that are not being reached?
I don't think it's necessarily about Daily Maverick increasing its reach, although of course That's what every newspaper or online publication seeks to do, is increase its numbers. But it's also a concern about the ecosystem in which journalism works. You know, you scientists, you're not only concerned about your own, well, you shouldn't be, about your own research, your own credentials. You're concerned about the environment that exists around you, its regulation, its ethics, etc., etc. I'm concerned about the ecosystem of journalism. You know, we have SABC. It has reached to 30 million people, I think, through its radio stations on a daily basis, indigenous language radio stations. You know, are we doing enough to make sure that the science, the understanding travels down those pathways as well? Because it really does need to. You know, there's nobody in this country for whom the type of discussion that we have had this afternoon is too clever or highfalutin. You know, everybody needs to get to grips with the science of this, all aspects of the science of this epidemic, and journalism plays a key role as a means of making that possible.
So, I mean, a lot of fantastic work from Tamar and others, and you know, is coming out in media outlets that you have to pay for. We've made this discussion already. The Daily Maverick is made available in Pick and Pay if you have a smart shopper card. There's enormous number of ways with the proper funding that health reporting on COVID could be made available to far more people. Is that a barrier that we actually need to put forward to government to say, look, help with this? Francois.
Sure. I do think, you know, access is an issue, and I think asking people in townships where do they get their news sources would be a good starting point. As Mark's pointed out, you know, it's probably not Business Day and Daily Maverick. It's probably other sources that I don't certainly have access to. So just have better research as to how to get to people and what is seen as a trusted source of news. You know, I have in my head who, in some ways, the epidemic's reinforced trust in conventional places. You know, I'll go to the Guardian, or I'll go to the Sunday Times, I'll go to the Daily Maverick or Business Day because I know those are trustworthy media sources. But that's not the case. Our colleagues post, you know, sort of every kind of news outlet on the planet, and all sorts of weird and wonderful places they're publishing stuff. Is how do we find out how do we work out where are those trusted sources and where are the easy wins in terms of providing this information?
Fantastic. So I'm just going to leave you with this question, Francois, from Val Mizrahi, who's made a statement on the chat, and I would suggest people just have a quick look at the chat, because it's very useful issues that we haven't had time because we have to wrap up. But as a scientist, I'm concerned about the epistemic imposter problem. Scientists and clinicians can be seduced, flattered by the limelight, but pontificating on science outside of one's area of expertise isn't helpful. And then she does go on to say, having said that, you know, to be fair, great respect for communicators. Are we imposters? Coming back full circle to whether clinicians and scientists have played a positive role, or are we imposters?
So I saw, and I think it's a good comment from Val. There's an unfortunate discourse, almost extreme thing, which is that we know nothing about this epidemic and everyone's no expert and has nothing to contribute, which is, you know, as nonsensical as saying, you know, everything there is about this epidemic, which is teaching us every wave is teaching us something slightly different. I think the difficulty is that many scientists are not willing to be interviewed. Some scientists have blacklisted certain journalists and won't speak to them. And then finally, there's certain scientists and clinicians who are prepared to go on. And it's hard. I mean, I get very nervous when I get, you go on television, you get some left field question that you don't have specific expertise, and fudging that in a responsible way, which is where I would put it, is probably a bit of an art. But you're right, Val. I mean, I think that there are, to my mind, some people are way too confident in their abilities and their opinions.
I think Tamar exemplified it beautifully on how not to answer a question that one doesn't feel good about answering. So it's been a lesson to us all. We have to bring things to a close now, it being the top of the hour, but I want to thank Tamar, Marc and Francois for giving us not only your time, but amazing perspectives on this issue. And although we may, as Tamar said, not be health journalists, I think the way that we as clinicians, scientists, public health, everyone in the field thinks about how we communicate in this time, and not just in COVID, because COVID is a template also for our need to consider how we try and communicate all of the health issues that we important to us and to the public, because it's far outside of COVID. There's so many things which we don't communicate optimally. So it's been a wonderful discussion. Thank you very much indeed, and thank you to everybody who joined. I'm sorry we haven't had a chance to go in depth into some of the points made in the chat, but they've been very useful. And this has been recorded, and we will be able to give it to a wider audience. So thank you, everybody, and we'll close the meeting here and have a wonderful rest of your day and wonderful weekend. Thanks very much.
Thank you.
Cheers,
Thank
everyone.
you. Bye-bye.
Bye.